Very good afternoon, students. Welcome on the classroom forum. This is a forum has been made for to take a practical classroom in afternoon hours. Our whole meeting link will be continued for theory classes in the morning. It also observed that in the morning there is no server busy. Server will not be busy. This time get busy. So it has been made the classroom meeting for forensic medicine officially. It starts working from today onwards. Only practical interaction, discussions, your record book drafting verification or two-way discussion. I'll hand over mic to you. Today's topic is spotters of medical legal importance, and we are taking this class as a parallel to the thesis that will help you to learn much better. So related to theory classes, we have started taking practical ask to what you are going to learn. This so this is a ask as a spotter to Viva, even long question, short note, everywhere is there, and this is a very important basic thing to learn. You should the original gastric lavage tube look like this one. What is this? It is a tube, and the tube is made up of Indian latex rubber. Has a funnel, one end, another end is just puncture holes. So in between you may find that is a suction bulb to create a positive negative pressure suck the fluid. So that is sometimes you may not have this suction bulb, some tube. What is a gastric lavage? Lavage with stomach washing. And it is a tube. What I have been shown is tube. When the spotter asks in the university examination, you should know only gastric lavage. You just say the gastric lavage is a process that is we are washing the stomach content and clearing that, removing the stomach content. Lavage, washing, and retaining some sample for the medical legal investigations to investigation of the poisoning tube. So gastric lavage tube is also called Boas tube or Eval's tube. If you write in a spotter, okay, in Viva also, sometimes maybe ask as a name, it's write a short note on Eval's tube. Maybe ask a Viva question, what are the indication and contraindication of its use? You see it is a 1 to 1.5 meter long and 12.7 centimeter broad, a rubber tube, Indian latex rubber, thick enough to pass without kinking and pass the fluid, and has the following parts. What are the parts has been mentioned, that has been given a numbers to here. So may not correct with this number has been shown on these pictures too, but has the pictures. Let me check what you label these tubes. I think we'll see that the tube in the beginning on the slide we have seen. What is a funnel? It is a mouth gag. It usually is a wooden or plastic, not metal, to protect the teeth. So a bite may be a rubber, so the gag is, mouth gag is shown as 8. The hole is the central hole in the mouth gag, and through this tube has been passed. We'll discuss this. It takes only teach or discuss with it, not a teach, a demonstration at 10 to 20 minutes for the only mouth gag. That when you come back, a physical classroom will take detail about this, but the theory part will, theory means practical oriented theory will take, and you find a tube. Number 5 has been suction bulb. A tube as a marking is there, 50 centimeter. You will find 1 or 2, 3 depending on the child or adult. If you are using the tube, there is a mark from the company made, or you may find a marking. You have to do measure the and mark at a 50 centimeter, and you might multiple apertures on the tube. Another end, one end is a funnel, another is in multiple. 2 and 3 has been mentioned here. Multiple. One get blocked. Tablets are there. And another will work. Creating negative positive pressure, you just remove the block. So this is the tube. So we'll see one by one. This is called Eval tube, gastric lavage tube, Boas tube. So funnel end. A mouth end to pour in and out to take out the fluid, which is the fluid is used in doing the gastric lavage, plain water, potassium permanganate, or maybe antidote. So commonly used oxidizing agent, potassium permanganate. So that fluid is pour and take it same for funnel. So this is a funnel suction bulb. Sometimes this bulb may be absent. To force open the perforations if blocked by the food material, tablets or anything. To take out the fluid by siphon method, that is the action. If it fails, without gastric lavage tube, you have to raise above the surface and below, that is taking a gravitational force. Sometimes it fails, so that will help. So that has been added. Siphon action, we'll see the later in this class. A lower rounded perforation ends, the stomach end you find, that is to avoid the damage to the GIT tract into the passage. So lower end is rounded and having multiple perforations too. Rubber tubing is marked as a 40, 50, 60 centimeter. Even 3 marking instead you may find 2 marks too. Mouth gag you will find, it is made of a wooden structure, and sometimes it may be plastic. White has been made, that is taken care of. Wooden to avoid the damages to the teeth, that is the, and has a central large end. So to pass easy, that is a tube, gastric lavage tube. And you not mouth gag has only central large. Again, another 2 you may find apertures too, and the gastric lavage, the mouth gag too. That here it is not been shown, but we'll discuss later that one. Only mouth gag. So indications to remove the poison, unabsorbed poison from the stomach. When there are indications that has been mentioned, when it is indicated, consume poison and attempted gag reflux, induce vomiting, or emetics has been given to induce vomiting, that is some solution to another emetics. If that fail and you want to remove the poison as quick as, so you can use indicated, that is one indication has been mentioned, the poison has been consumed, all poison has been consumed, that consume poison oral. So that one indication is the poison has been consumed, so you have to take it out. And any ingested poison within 4 to 6 hours. It doesn't mean it is maximum time has been in the first 4 hour, 2 hour has been reached to the hospital, or attempts has been done. That has been maximum of the ingested food. Sometimes there's some tablet, salicylic acid, that is a aspirin tablet, maybe concrete, maybe hard stuff in the abdomen, in the stomach. What I mean, ingested poison may be a powder form, maybe tablet, maybe liquid. So some tablets get compiled and form a very hard mass to, and that mass to absorb take a time to. Even can be attempted up to 6 hours, but if you know the poison, which delays the absorption and emptying, so depending on 4 hours, that is stomach emptying time. But patient is depressed or unconscious, stomach emptying time is delayed. So has been textbook picture has been given, that is 4 to 6 hours. Limitation, some can be attempted if a person immediately got in a shock and rest of the parameters are good. So and you want to remove the poisons, even so can be done. Even if the poison has been ingested more than 6 hours earlier, gastric lavage may be useful, since in case of depression, unconscious gastric lavage time is increased. Another, all the poison which has been ingested, and another indication is the poison which is injected. It doesn't mean in examination student may say the spam bite gastric lavage tube. Don't make, just make a conscious mind. Just only when the poison is there, 1 or 2 poisons that can be person has consumed is injected in a parental route, and that is excreted in a bile, a stomach, through bilious. So that can be regurgitations. You may find that injected morphine, whitish latex, you find stomach, that can be removed. So that is one poison has been mentioned, one another is indicated when all the attempts, emetics, attempted vomiting induced gag reflex, and that is failed to remove the poison. So the rest of the unobserved poisons has to remove the quickly and save the life. So can be used, but another is injection morphine. Contraindications are there of this. The one point that is has been mentioned, centimeters to 1 millimeters, 12, 11 and 12, it just has been mentioned depending upon. So that has the maximum inner diameter outer 12.7, 1.2, and so just the centimeter, that much thick to pass. So it is a contraindicated in children. The children are small. You cannot use this tube to remove the unabsorbed poisons. So one that indication is children. Looking at the tube diameter, inner diameter again much lesser. So that has been one indication in the children's. You can, and remember, maximum contraindications are related to CCC are there. Another C is a corrosive poison, a concentrated poison corrosion. Already stomach is a thin, like sulfuric acid, black color, a thin, like paper, wet blotting paper. You have seen the blotting paper made very easily. Just you pass the tube, there is soft, just touch the perforation, peritonitis may occur. So in a corrosive, when concentrated, all corrosive except the carbolic acid, classification of poison you have recently learned. That is, corrosives are inorganic and organic corrosives. In inorganic you learn that is a mineral, acid and alkalis. So concentrated except in the organic that has been mentioned, carbolic acid. That is, in the carbolic acid, leathery, like hard, lathery. Is different. Leather, you know, lathery, you just that is a different the word we have seen a drowning. Leather has a very hard, tough. So chances of perforation is less in the carbolic acid, except that carbolic acid, you can just remember CC again has come here. Carbolic acid also called phenol. So it is a absolute contraindication, gastric lavage in corrosive except carbolic acid. Nitric acid perforation is there. If diluted form, use judiciously. That is here, depending on concentration and damages, insult to. Another is a convulsion. Person is having convulsive poison, consumer convulsion, and you are passing the tube, induces a convulsion and a bite. That has been you have to sedate and then the pass. Some you have to do the convulsion. Take care, great care. So not absolute kind of contraindicated, but convulsive, one of the contraindication has been mentioned. Children use the tube, some are smaller in diameter, means the Ryle's tube. Urinary catheters can be used, a rubber catheter, soft. Coma patient, you are attempting a coma, or petroleum distillator, like kerosene poison, you take one. Kerosene is very common poison among the children in summer days. So when you attempt to make that, sometimes the spillage occur in the respirator, that is very, very dangerous. So to avoid these petroleum distillators like kerosene poisoning, coma, C coma, and now how to remember the petroleum, that a K, C or K, one K is a kerosene poisoning. Among the commonest we have taken, coma, children, disorder, cardiac patient too. That again you can add a C. Some standard textbook has been given a cardiac patients too. These are the contraindication. What this has been shown, this picture, you just observe this, whatever it is, what do you see here? Foot end has been elevated. Yes, so low head position. Again, which lateral position has been given? You know the stomach, upper end and lower end. Which position? Left lateral or right lateral position has been given to the. It is a position. It's called tender lumbar position, prone position, semi-prone position. Maybe used in science some tender lumbar position. You are attempting the gastric lavage. You are inserting tube. Then the rest of the procedure will learn later. Just see the pictures. What do you see here? Yes, lower head. To avoid the aspiration, easy emptying left lateral position has been given. And the tube has been raised above. When suction bulb is not there, just push the fluid, pass the fluid in the stomach. The gravitational force will go. Pinch it and make a lower end. Again release the pinch. So that symphon action, sometimes it fails, then if you have the tube has a suction bulb, that is a bit easy to symphony action will be make easy a negative pressure. the gravitation higher to lower, the fluid moves. This picture, just you remember, some textbook has what has been mentioned also. What are the precautions to be taken? One is the position, which is the position, low head position. The patient should be a semi-prone, a prone position to be a left side. Head should be lower than that hip to help better drainage, one, and ensure clear airways. A danger if is there, that had to be removed. While attempting, patient may not be cooperative, even is conscious, may not allow to pass the tube size. We'll discuss later what is the parasuicides, but and what happens sometimes maybe a threaten to want their desire, like a motorbike, consumer poison. I have observed in the clinical posting, they keep a poison in the oral buccal space. They won't consume and demands, and later agree, then spit it out. They don't want to die. Sometimes this poison may be forced to go. So they just before putting a tube, and just check the buccal space, even teeth danger is there or not, remove it. Otherwise that danger may be as may lodge in the respiratory tract and gagging, choking. To avoid that one, that the danger, even if just before that putting a gastric lavage tube, just inspect the oral cavity. Is there any poison granules maybe in the buccal spaces too, like a tobacco? Mouth gag should be always used. Mouth gag. Without mouth gag, patient may be convulsive, may pinch the clutch, or tube, or maybe damage, a cut with the teeth. So mouth gag, and that is mouth gag is a wooden made or a plastic, soft plastic. So that is to be helped to avoid the biting of the tube. Ensure that tube is in the stomach only. That is very important. Is when you pass the tube, so you have to just keep the stethoscope on the stomach and just do the your mouth is tubing is here in the stomach or maybe respiratory tract. That is a very important. Ensure after passing through. The first washing should be done with the plain water, and that is very important, and that using only 100 to 200 ml of the water, because this sample is to be sent to forensic science analysis. That is very important. First washing is to be written in a bottle, and that is packed, label, seal well, and handed over to the police officer taking a receipt. That is very important. That will help. What happened in the postmortem, we find patient hospitalized for 1 month, 2 months, and then died, complications, and we do postmortem in such cases. So the procedure law, even the poisoning case died after a month. So even though you have to retain the viscera, doesn't mean that presume that there is no poison. But doctor might have been cleaned or omitted out, defecate has been removed, purging, loose motion. But that's story. But procedural poisoning case, viscera has to be retained. Even patient die after 1 month or 2 months, after a certain period of. So you have why we are keeping a liver along with the gallbladder. Traces of poison you may find the gallbladder, even if patient died delayed death. So that is very important. Half kg of liver along with the gallbladder must be written. Poison will get even 1 month, 2 months. When you collect the viscera at autopsy after 1 month, so that handing over the viscera, do not declare anything. Just declare means do not tell will come or not to investigation. Is only your duty to say that patient is hospitalized in this hospital and they might have been written the gastric lavage fluid. Please collect, and along with this viscera bottle and the gastric lavage fluid has been written by doctor, both club and submit in once, because they have get one permission from place from here to the forensic science laboratory. The original. Suppose in Pondicherry, from Gorimedu to from our institute or any institute to the Gorimedu, they will go at once, not to have again go for the collection of gastric lavage, or you may not given direction correctly. So they fail to deposit, and when you receipt after gastric lavage fluid, you find that that is minimal traces, a non-fatal poison may come, or maybe not detected the poison. Then, and that time you cannot say that gastric lavage has been retained or not retained. So this is a good time when you do autopsy and collect the viscera bottle and pack labels. In that time you handing over, might have been written just, and that note you keep in your autopsy your file. somewhere you write down how you have instructed the police. Court may ask you, because you are the qualified person, have given instruction to collect the gastric lavage fluid from the treating institute. Sometimes it may happen for primary health center, you are doing that autopsy and you have to hand over along with this the gastric. That sample, first sample, patient is alive. Here gastric first washing has to be retained. That is packed, label and seal and handed to the police. The continuous stomach wash till the color in the ingoing and outgoing is the same continuum, and still, because once you put like a potassium permanganate, they get pinkish purple color, you just put in they will come returning fully the same. It get change every time. When last washing returning fluid will send, then it is a maximum poison has been written. Maybe a light shading pale may come. So and pinch the tube before removing to avoid the aspiration tube. And absence of a gastric lavage tube, any rubber tube or a glass funnel can be used. That absence of gastric lavage tube, any rubber tube is not there. So any rubber tube and a glass funnel, you can make like gastric lavage stomach washing tube. Nowadays, that the tube that is historical, I see even our museum is there, but most of the I see that image EMS, I go, instead of they are using gastric Riles tube. They find the best, but the want to clear the stomach wash, the best is gastric lavage tube. In a short time, you can remove all the poison. I'll recommend the gastric lavage tube better than this Riles tube. Nowadays is available a Riles tube. That has been mentioned, not available. You can not available gastric lavage at my center, so I cannot do. No, you have to make them or find the Riles tube nowadays is available. Use it and do. But compared to the gastric lavage tube is the best for washing the stomach. This one impression has the same. You have to use funnel or syringe, 20 ml syringe, and push the fluid. 200 ml means you just multiply how many times you have to 10 times you have to 20 ml you have to push, and again return that symphony action. So what is the procedure here? You may be asking viva questions, and actually it is very good. You learned, although this is life-saving process. It is a must-know category. I'm taking the spotter as we usually keep in compulsion. 1 or 2 batch, 3 batches are the 4 batches are Friday exam. 1 or 2 batches you'll find this gastric lavage is compulsory. The procedure, after positioning the patient, tendon burst position, head low position, his head is below, and also a patient is a shock. So elevation of the foot, the compensate the fluid tube. So the importance are there. Positioning the patient, the teeth are open with the mouth gag. Yeah, patient may not cooperate you. The mouth gag open. How a mouth gag? You just find the mouth gag has a 2 ends. One end is like pointed, one is blunt, a pointed, sharp pointing. Pointed is a conical, a pointed that you pass it, and the teeth in between and open. That is one of the function of the mouth gag. We'll see later. The lower end of the tube is lubricated. You funnel and have seen another lower end that's lubricated with water, a soap or milk, liquid paraffin or castor oil. It is passed through the opening of the mouth gag. That is mouth gag in the oral cavity. Patient may close. So central hole is not be visible, while patient may be not allowing, not cooperating, rushing your hand, not allow. So once you pass in the oral cavity, if you are standing on the right side, so rotate in such a positioning, so clockwise or anti-clockwise, in such a position that the tongue will not fall backward, or that causes gagging. So right side it is there, then you are going anti-clockwise and clockwise over, tongue will fall anti-clockwise. That we'll discuss in a physical classroom, okay, on dummies. Okay, so here that is a very important technique, that how to pass. The 2 extra punctures hole we will find on the mouth gag tube. That allows you the position of the central hole. That is each other as perpendicular. In some textbook has been mentioned that is puncture you use to tie the mouth gag around the head. That is not useful. That is to identify how is the position. Is a horizontal central position or a vertical to pass easily. So till the 50 centimeter in adults, so ensuring that the tube is a position in the stomach. In case enters respiratory passage, what you will do? Cough comes, reflex starts. Another is patient unconscious or maybe lost, then hissing sound heard at the funnel end. if it goes in the windpipe, or you find air bubbles in if you dip the funnel in the water. So this can be testy. Another to confirm the tube in the stomach, it is from the funnel end to auscultation on the area, stomach area, just auscultate and just see the, if you are using Railstorm air or gastric lavage suction, that pinch one end and just suction bulb, you just put, you just hear the sound. Auscultation, you can do this. Trick and fine. Okay, at this position I have a doubt till this. If you have a doubt, can be chat, because let me see is the recording well or my audio is going well or not. Sometimes it may happen suddenly that get a close and I'm talking myself, it may happen. So to avoid, just I take a break. Okay, no, shall I continue? Okay. So the first washing, what has been done with the fresh water, a small amount only is used, that is 100 to 200 ml, to avoid the sweeping forward the poison into intestine. That's why, that's one reason why it has been not been taken a liter and more. You know the capacity of the stomach, but how much fluid has been taken? Little. That will mix with the poison, and not to push the poison to the stomach. If a patient comes early, already you can give purgatives and other things too. So 100 ml. Later lavage is done with the plain water or KMNO4. You continue with the plain water or potassium permanganate, that is KMNO4 solution 1 in 1000. That's 1 gram per liter. And it is a strong oxidizing agent, and it is a poison too. Remember 1K. So how much has to be taken? That you will demo. Take up that is 15 liter bucket and a pinch full, and how the color you will do. You just remember here, that is appreciation and seen. It is a theoretical, online, it cannot be. So we'll show in the casualty. Each time about 500 ml, half a liter, a fluid is passed into the funnel end and held at the higher level. So this fluid will go in the stomach. So higher than the body, and fluid enters in by the gravity, and after 50 to 30 seconds, let it allow the mix with the stomach, and the funnel end is taken lower down with the level than the body. Now when the fluid form, the stomach will come out from the syphon action. So this is so you can take it again, you can confirm that is 500 ml fluid you are inserted, along with the extra will come by more than 500 returning fluid. So process is repeated till the color of the nature of ingoing outgoing, that is pink color, oxidizing color, same colors comes, but it's altered because of the poison. The poison still is there in the stomach. So ingoing outgoing fluid is the same till, that is you can say now it has been washed, not altering because of the poisons. For the whole procedure, about the 10 liter of the fluid is required. About the 20 washing means you can get 1 bucket, that is 15 liter. So it may be required more too. About 20 washing can be done, that is calculated here. But actually the doing job in the EMS, that is the best learning. Once you see the demo, that is you will not forget. This is you just see this taking online classes, may you remember for 2 hours and next 2 days. So for such things you have to read 30 times, but demonstration once you can remember lifelong. But is this theory part, repetition, how many number of times you do. Imagination is work to take care of the poison that escape gastric lavage, well, remains sticking to stomach wall. Sometimes some poisons may be stick adherent to the gastric mucosa too. So how to detach this? So what to take care of that poison, how to neutralize that poison? So what we do, some portion will leave in the stomach of this our oxidizing agent, gastric lavage fluid tube. So one of the following can be left in the stomach. The fluid you can leave, do not again take it out. Potassium permanganate 1. Demulsion, they protect the mucosa of the stomach. Demulsion like milk, protect the mucosa. Agalbumin, you are going to learn the theory part, that can be. Sodium magnesium sulfate as a purgative. Poison at the end, you can ask some poison maybe in the incident, give the purgative. This is the purgative has been mentioned. So that remove the poisons which are present in the early or even intestines that cannot be removed from the stomach wash. Soda bicarbonate in case of acidity, acidosis to avoid. Activated charcoal is an adsorption. Yes, spelling, let me correct, adsorbs. If you put activated charcoal, how to make activated charcoal, that is a question. Sometimes if it is not available market, okay, you want to is where we are doing the hospital, but poisoning are the cases may occur at the home too, and health worker asks how to make the activated charcoal. So those people have a toaster burner, you know, a toast, chai toast, you know, the toaster, a bread you burn in a toaster to complete make a char. That is the easiest way to make a charcoal. Burn a bread or toaster in a toaster maker and make a black, and that crush and give along with it, that absorbs the poison, and that is one of the best that can be made. The tube should not be pinched and should be pinched and removed to avoid the aspiration into the lungs. In children, gastric lavage tube is done with a rice tube, or maybe that tube is sizes are very graded sizes are there, or rubber tube. A urinary catheter to a small. I mean, children means we are even maybe infant, maybe has been given malicious intent, maybe older children to or teenage to, depending upon it. So the rubber tube can be a gaze and just. A 30 centimeter is necessary to reach the stomach. That's why 40, 50, 60 has been mentioned. But it is a major from the zipisternum to ear to nose, and that inserted. That another technique that depending on size, height, that's a proportion. So it is not exact 35, that need expertise. So we learn with whether in the physical classroom or demonstration is that how to measure and how to insert. And this is the potassium permanganate has been shown here. A crystal, and another is another similar look-alike. And we have these two compounds in the same side lab. If you are working medicine lab, toxicology ward, even forensic medicine laboratory, and some, you may find the laboratories too, the same looking like crystal. So that confusion, maybe asking a Viva question too. Potassium permanganate crystal, another crystal look alike. This is another one is a iodine crystal. Suppose ask your resident doctor, emergency, go and bring, and you find the bottle label has been missing, and bottle contain the potassium permanganate or other similar substance. This is another one has been shown as iodine crystal is dangerous. Even vapor, when sent to you and bring the bottle. So never it is iodine you have in the question mind, that is it is iodine or potassium permanganate, never smell, odor, you don't take a odor of such bottle. Okay, this is a odorless and this is a odor comes, but is a patient may hypersensitive and may collapse and may go in shock. So it is risky, but how to identify? At a room temperature, bottle side of the bottle you see pink color, such color, so I think it is iodine crystal. Potassium permanganate won't leave this staining on the side of the. Your lab is in AC room, may not be. So just remember, just tinge you find pale color, do not, this is the thing, is not a potassium permanganate. Okay, this is the thing is the, in the examination, as a spotter has been asked, then what are the things you are going to write? This is 2 minutes are there. So gastric lavage tube, one, clear. Student write only, even snake, you student write snack too, some E missing or some different spelling, just work on that, write 1, 2, 3 times. Okay, cobra, I have seen the C started the cake, cobra, like a cabra, like cobra may come spell mistake. Even I have seen the crate and that is C comes, so just practice that too. So these are the, so what into rewrite, you are just good listener now, but you attempt to, and I know that you have written your exercise too. Which forum? Now we have a time. We can discuss now, anybody is willing to show their draft and want to discuss updated one, good one, a better one. A competition is going on, so this is the only forum I can allow you. If not, you don't want to discuss, interact two-way, then I'll close the mail. Just have any question on this one, can be put in a chat box. I'll see in the chat box. Okay, yes, chat box is ready. If I have a slide, I'll keep the slide on, otherwise I have to close this video because save your data to video. I'll come on the audio class hereafter. Okay, have a doubt on this presented slides? If not, then I'll close and I'll come to audio class. So we'll discuss. Any slide on has been written differently, presented differently. Have I raised the question on the slide? I'll go, okay. Otherwise, I'll close this video. Then second time I will not come with this screen. Okay. What you are going to manage in the keep in the mind gastric lavage tube. You can write parts. You will get full marks, but the part writing numbers. Instead of you write indication and contraindications. Student write only CC, all contraindication finish and I expect 1 mark. You have to write more and more when you are able to. Okay, screen is not clear. Is it data? Okay, screen is not data. Maybe there's again server issue from my side too. When a 3G or 2G you go, then a screen get blurry or hazy. Okay, I should not come. I'll make a slide bigger that I can do too. Okay, full screen you want that I can make, and yes. Activated charcoal used for all the poison, yes. Adsorbent action. We'll discuss later, but now we are talking about general poisoning. Here any poison has been mentioned, just a gastric lavage done in which poison has been consumed, oral. That is we are doing. Injectable one has been mentioned here as example. Or any poison consumed orally. Even not consumed, but he may be faking, we don't know. You have to retain the first slide, that is gastric lavage. So activated charcoal can be added. That is adsorption if poisoning is there. Yeah. Next. In all poison, in general, we are talking general toxicology, general consideration in that forum. The theory class is going on, so I picked up this information. I thought this is a spot commonly asked and discussed in Viva too. Even MCQ comes on the gastric lavage tube. Which are the various gastric lavage fluid used in different poisons? One question has come, that is activated charcoal used in all poison. Yeah. All means here unknown poison. Unknown poison, there are two. We'll at the end of the toxicology class we are going to see the how to known poison, unknown poison, management of unknown poison. Where you presume that unknown poison is there, not known. Doesn't mean that person has consumed a poison and that smell you can probability is this poison has been consumed. That may comes. So if you have general toxicology, yeah, you just make a rule that is all poison adsorption. Yes, anything? There's a powdery form, liquid form, adsorb. Very, yes. So many people are typing, but I see only one or the, are you chatting each other on the background? I have little doubt. Multiple users are chatting, I see, but come question one. Or they just type blank again, delete the type, so you make a busy, distract you. So I'll hide this or keep a full slide. This is up to you. Which slide you want to see full screen, I'll make that full screen too. I'll give 15 seconds each slide. Again, want to take a snap or you want to read it over, have a doubt, just tell me. That I'll go and I'll take with that one. Okay. This slide has come here. Now you want just I'll go away and I'll make you to see the full screen now. Yeah. This has been mentioned only parts of the gastric lavage tube. You practice drawing, even long question may come, part of the long question. That will be help to easy to draw. Make a practice. Even if you spotter you right, you will get full score 1 mark. 1 mark spotter means that is a 10 marks. 10 mini points should come. That is comma, telegraphic notes, 10 points you will get 1. Or more than 5 you write, you will get that turns to 1 in a 2 minutes or 2.5 minutes. So next slide, I made a picture. That is a gastric lavage tube. They also called eval tube. This is the best to remove the poison and check. Next, a Boas tube, gastric lavage tube has been mentioned, Boas tube, eval's tube, and there has been mentioned parts. Even you this right, you will get full marks, but you have write do write all the form, the procedure, description about the tube, Gastric lavage fluid used commonly, which along with the gastric lavage fluid, what are the other things has been added, you can write that. A same tube can be used. These are your standard textbook pages. Indications has been mentioned. Two indication, all poison has been consumed. Known and unknown. Patient that comes again delayed. Even you can attempt more than the stomach emptying time, more than that. If a patient is depression, unconscious. So in these cases, patient is a coma, gastric emptying time is delayed. So it can be attempted. Apomorphine, that inexcreted in. So indication contact, you may find your other standard textbook has been CC, more has been given. C for corrosive, convulsion, children, coma patient, cardiac patient,